This is a question and answer session related to Foley cath insertion, irrigation, and removal. Go.
What happens if you insert a catheter and you don't get a urine return and it appears you may be in the vaginal canal? What would your next step be?
If your sense is that that catheter is in the vaginal canal and not in the meatus, you will leave the catheter there, never to go there again, and you will reset up and attempt insertion. I've had as many as 4 catheters hanging out of a person. This would be a woman prior to getting it in the right place. Next.
You walk into a client's room and there's urine all over the floor and there appears to be a hole in the Foley bag. Can you just change the bag or would you change the whole system?
I would recommend just changing the bag. When you change that bag, you want to be sure that you use a sterile aseptic technique when you do that, when you're separating the catheter from the drainage bag tubing. Most of our bags, and I would say probably all of them now, have a filter in them that causes a ascending tract urinary infection, because those bags do harbor microorganisms. So we don't have to worry that there has been an ascending tract urinary infection because of the broken bag. Good question.
If you were doing an insertion and the patient complains of pain, what would you do?
This is a really great question, because sometimes this does happen. If it's pain, this is not necessarily a real comfortable procedure, although it should not cause pain. If I suspect that the catheter is not into the bladder yet and I'm still in the urethra, I would withdraw the fluid from my balloon. My catheter is still sterile, so I can insert it further and then blow the balloon up again. I'd have to think further if they're still complaining of pain. But initially, that's what you would do. Thank you.
In what ways could you relax the patient prior to discontinuing the catheter?
Now that's a really great question, because when I demonstrated, I forgot to say this, and one thing we can ask the client to do is to take a deep breath. And do I want that client to hold the breath, or do I just want them to take several deep breaths? When I'm removing the catheter, you can see it doesn't take very long. So, but it's a little redirection, plus will help to relax the muscles, hopefully. Thank you for asking that.
What do you do if you walk in and there's no output in your catheter bag?
That's one to think about. So one of the first things I would do is to check the tubing from the meatus down into the drainage bag. So if the client is lying on that tubing, that may be very well, and that's not unusual for that to happen. That may very well be why it's not draining. If I have an order to if that is all, the tubing is clear, there's been no kinks in it, it appears that urine should be flowing freely, then I may need to remove that catheter and insert a new one. If I have an order for irrigation, I could attempt to irrigate it. And if I have that order, then I'm going to be able to know right away, do I have a problem with the openings of the lumen of the catheter being filled with sediment and or mucus, and that's why the catheter is not draining. First thing I'd do, though, is check the tubing. Anybody else? That's it?